26,700 children died last year from the flu. But you wouldn't know that because the media didn't care to tell you that. And because the media didn't let you know about those 26,700 unfortunate children, you didn't even know. And that was from the common flu.
That's it. And now here we are with this pandemic where 1 in 4 people worldwide are quarantined over this coronavirus. Okay, how many other coronaviruses are there? We're up to 19, right?
So here's the deal. We touched on it last time, and I wanted to clear some things up. Obviously, my thing isn't you shouldn't be safe. My thing is it isn't scary. My thing isn't who gives a fuck. My thing is care about everything equally. There's a ton of things going on in this world that is dangerous, scary, hurtful. And there's stuff that has happened, like those children that died from the flu last year that you didn't even know about. It's flu season right now. Right? It's flu season. Do you get sick during flu season?
I do get sick during flu
Me
season.
too. And guess what?
Every year.
It's inevitable that I'm most likely gonna get sick this flu season. I'm not scared about getting sick, but what I am scared about is how everybody is going to react from what the world is doing because of this. And when I say this, it's something that the media and world and government are choosing to implement into your lives as being an epidemic. How is everybody gonna handle being out of school? How is everybody gonna handle being out of work? What's gonna happen as far as money? I'm worried about what's going to happen in this world.
The economy's in the toilet right now, and nobody's batting an eye. Everybody wants to talk about, oh, the coronavirus is affecting our economy. That's what they want you to believe. They want you to believe that the reason why the economy is in the crapper is because of coronavirus, when really it's not the coronavirus. It's the fact that we've been propping this economy up on quantitative easing since 2008. We haven't recovered since 2008. Since the housing market bubble crashed back then, and we're still trying to make up. So the government prints more money and prints more money, and now to pay off all this deficit, we got to print $2 trillion and throw it at the markets.
So let me get this straight to tell you guys something. The media is a business. I want to clear that up right now. The media is a business. It's just like any other business in the world. It wants to generate money. It needs to make money. How do we make money? We make money by creating a strong stance. And then what that does is the viewers take that strong stance and they either A, side with it, which happens most of the time, so they get a ton of people to side with them, back them up, and then that strong stance also creates an opposite impact where they're like, no, what they're saying is completely wrong, which also generates views and creates an impact on society, and that directs traffic to watch the media.
Exactly. And if you look at what scientists, doctors, and epidemiologists are really saying about this coronavirus, and they're starting to look into facts and say, well, hold on. I mean, as many cases as I've seen of this, how many people have recovered? This doesn't really look like anything other than an average flu season.
An average flu season.
Is what they're saying. That's what they're saying.
And you know what's crazy? Do you know how many people died last year from the flu?
How many?
50,000 people died from the flu last year. And that's the common flu that nobody bats an eye about, nobody gets scared about, and we have all the vaccines in the world, and we have that all under control, and 50,000 people still died from that last year.
How many people in America died from heart disease this year?
650,000. I know you guys don't give a fuck about that because the media isn't blowing it up and we have complete control over that. Yeah. But that's 650,000 people died over something that we have a lot of control over.
Just make sure while you're in quarantine that you decide not to grill up that nasty ass hamburger with cheese and diabetes all over.
Because guess what heart disease does? It increases your chances of death by 10% to die from the coronavirus.
Boom. So there you go.
And if you're healthy, you only have a 0.5% to 1% chance of dying.
1% kill rate, people. Oh. Oh God! Oh, we had to close down Tim Hortons because of a 1%.
I can't even
rate.
fucking get coffee!
Oh my God! Oh no!
The schools are closed! I can't even go to college! But guess what? The world brainwashed you to think that's okay! The world brainwashed you to think, hey, everything's shutting down and all this shit happening is perfectly normal. I think a lot of people are like, what the fuck is Eric's problem? Let me tell you what the fuck Eric's problem is. The media has full control over the world as far as how you perceive things. Life is nothing but perception, as I always say. Here's the media. Scare, 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 scare. Every worst case scenario there are. And I understand your guys' fight is, well, we need to know that so that we can stay safe, and that's gonna make sure that, you know, something bad doesn't happen. I get it. But here's the thing. They take over and get your views by instilling fear. Because the big thing is about this situation is they are talking and they are warning and they are preparing you and they are making sure to protect you because the media is so great, but they don't give a non-biased point of view. They don't explain the likelihood of you guys getting it, the concept that you don't have to be that scared. My problem is they're not giving the overall story. They're giving a one-sided story of fear and not explaining all the facts behind it as far as the likelihood of you getting it.
They want to create problem, reaction, solution. So the same people that made you feel afraid and dissonant and disconnected from society
are gonna save your life.
They're gonna save your life, and they're gonna be your best friend. They're gonna be the ones that put the mask on you, gave you the vaccine, and made it so you had to pay $9.95 for your freedom. And it's bullshit. That's not what we want here in this country. That's not what we wanted here. Frank Zappa had a quote that said, "The illusion of freedom is only dependent on the fact that it's still inexpensive to have that freedom. Once it becomes too expensive for you to have those freedoms, all the show's over. And the lights go up, and the curtains go up, and all the set pieces get pushed back into the backside, and all those curtains get pulled right up, and you see the wall behind the curtain. And then you're fucked."
Guess who we have to rely on then? We're gonna have to rely on the government and their control.
Problem, reaction, solution. Every single time.
When there's real problems, we need solutions. That's fantastic. But when we're magnifying a problem so that we can create a solution so that we can be perceived in a certain way and gain something out of it, that is my problem.
Nasty,
it's honestly
garbage.
like, I'm not a statistical major, someone who knows everything, but I do know a little bit about sociology, social work, things that impact a human. Let's compare this media situation, the coronavirus, to a child that is being told something irrational by somebody they look up to. Let's say the media is like your mom and dad. They can tell you the most irrational shit, and if they fill your head with it, they have a choice. They have a choice to tell you rational shit, irrational shit. And if your parents decide to tell you that, hey, give me something irrational, you're pretty good at being creative, but if your parents tell you, like, hey,
the moon is made of green cheese.
If the moon is made of green cheese, or if you can fly to the moon on green cheese, and they keep on saying that over and over and over and over and over and over again,
and then maybe they're telling you, if you don't believe that the moon is made of green cheese,
you will die.
Then we're gonna harm you. You're gonna really get hurt if you don't believe that the moon is made of green cheese. Eventually, they're gonna know the moon was made of green cheese.
Well, you're never gonna be able to get to the moon and see that it's not made of blue cheese. But guess what?
Exactly.
It's called conditioning.
Conditioning.
You look up to the media.
Exactly.
I look up to my mom and dad. Well, I don't know. Maybe I'm wrong. I don't have parents. But you most likely look up to your mom and dad, and you're going to believe everything that they say. So if they tell you some irrational shit, you're going to be conditioned to believe their irrational shit. And because you look up to them and trust them and believe in them, the bad people are me and Asa, who are telling you differently. Guess what? Your mom and dad, they're full of shit. Oh my God!
Oh my
Talk
God.
about your daddy.
That's not the whole gist of it. Your mom and dad are no smarter than you and me. And that's the main point, is that the media is no smarter than you or me. And none of these people in the press have done any of their research. They're basically paid actors. They got the gig through, what's that one, brandpartners.com or whatever?
I think Indeed.
Yeah, exactly. They got the job through Indeed, okay, and they're just a pretty face that they put on the camera to read the teleprompter and tell them what to say. And I'll send you a link to that. You can put it in the video where it says they literally all say the same thing.
Same thing. And what do you get? Shut up! You get repetition. Repetition is great for you because by the time you hear it over and over and over again, because most of you guys are just sitting in front of the TV like, feed me, and you're fucking getting fed.
Right.
That repetition is literally becoming reality and it's becoming fact. And if somebody says something different,
it's over. Exactly. And then that repetition, like you said, it becomes your reality. It really does. Because eventually you start to meet people who maybe they were immune compromised and then they did get the coronavirus and it was serious for them. And this person was in a coma and that person died. And then the other person was, hospitalized for an extended period of time. And these people were on ventilators because it's still flu season. And the people who are infected with coronavirus are next to the people who are infected with allergies and regular flu and all these other illnesses that come about in springtime and in fall. So maybe it becomes serious for you because just of what the media has portrayed for you. It's like The Secret. What you believe becomes your reality. Okay, so, and I hate to be kind of vague about The Secret, but at the same time, it works in that direction. If you believe one day you're going to be a millionaire, or you believe good things about your life, that's going to happen for you.
You will.
Same with the inverse, man. And the media tries to control people through what? Fear. Okay, and they try to take they're literally living in your mind rent-free right now. In fact, you're paying them to live in your mind when you pay for your TV and internet. Okay, so what the hell, man?
Facts. Oh my God. So I did want to touch on, I've talked to a lot of people about this. All the people that you know that are being impacted that, I do want to apologize. And my thing isn't that it isn't real. I could go run in front of this car right now and get hit by it. It's not that that's not real. Getting hit by a car is real. The coronavirus is real. Everything's real. It's not saying it's not real.
Right.
And I'm sorry about any of your friends, family, me, if I get the coronavirus. I'm sorry about anybody who fucking gets it. So it's not about it not being real.
It's about how you perceive it.
It's about how you see it.
Exactly. And the way people are seeing it right now is that it's this global epidemic. It affects all these people. We're all scared. Everybody hide in your house because the deadly upper respiratory infection is going to kill my children. Oh, no. This shit doesn't even infect kids, man. Come on.
Actually, one died from it.
Oh, one child.
But remember the 26,700 that died from the flu last year?
Yeah. And that was last year. And nobody bats an eye about that shit. This is no different from swine flu, H1N1, Zika virus, Ebola. How many have we had over the last 10 years of these?
It just keeps coming every 2 years.
Every 2 years there's an epidemic. What the fuck is that?
So again, I care about all the people suffering from it. I care about all you who are suffering from it. All your friends who are suffering from it. I care so much about.
Right.
Just like I care about all the other illnesses, all the other heart diseases, all the other flu deaths.
Right.
I care about everybody's health equally.
Right. But for them to just make a big panic over all this stuff doesn't make sense. And it leads me to a larger topic, which I'll get into in my video.
Conspiracy!
Exactly. And
we're not going to do it over here on this channel,
right.
But we are going to do it over on Ace's Sales channel.
Exactly.
So go check it out.
Exactly.
Make sure to watch the video.
Boom.
Share, like,
Boom.
subscribe.
Boom.
Because everybody has to know, don't be scared.
Don't be afraid of this
And
shit.
Ace is coming to get you on the new shit.
I'm coming.
Be ready. Go check out his channel now. Everybody have a great day, and I can't wait to hear your feedback. Peace.
Dr. Joel Kettner, who's a professor of community health sciences and surgery at Manitoba University and former chief public health officer for Manitoba province, said, "I've never seen anything like this, anything anywhere near like this. I'm not talking about the pandemic, because I've seen 30 of them, one every year. It's called influenza and other respiratory illness viruses. We don't always know what they are. But I've never seen this reaction, and I'm trying to understand why. In Hubei, in the province of Hubei, where there has been the most cases and deaths by far, the actual number of cases reported is 1 per 1,000 people, and the actual rate of deaths reported is 1 per 20,000. So maybe that would help put things into perspective. Dr. John Ioannidis is professor of medicine, of health research and policy, and of biomedical data science, said, patients who've been tested for SARS-CoV-2 are disproportionately those with severe symptoms and bad outcomes. As most health systems have limited testing capacity, selection bias may even worsen in the near future. The one situation where an entire closed population was tested was the Diamond Princess cruise ship and its quarantined passengers. The case fatality rate there was 1%, but this was a largely elderly population in which the death rate from COVID-19 is much higher. Could the COVID-19 case fatality rate be that low? No, some say, pointing to the high rate in elderly people. However, even some so-called mild or common cold type coronaviruses that have been known for decades can have case fatality rates as high as 8% when they infect elderly people in nursing homes. If we had not known about a new virus out there and had not checked individuals with PCR tests, the number of total deaths due to influenza-like illness would not seem unusual this year. At most, we might have casually noted that flu this season seems to be a bit worse than average. Dr. Yoram Lass is an Israeli physician, politician, and former Director General of the Health Ministry. He says, Italy is known for its enormous morbidity in respiratory problems, more than 3 times any other European country. In the US, about 40,000 people die on a regular flu season, and so far 40 to 50 people have died of the coronavirus, most of them in a nursing home in Kirkland, Washington. In every country, more people die from regular flu compared with those who die from the coronavirus. There is a very good example that we all forget, the swine flu in 2009. That was a virus that reached the world from Mexico, and until today there is no vaccinations against it. But what? At that time there was no Facebook, or there maybe was, but it was still in its infancy. The coronavirus, in contrast, is a virus with public relations. Whoever thinks that government ends viruses is wrong. Definitely agree with the final statement there. And Dr. Pietro Vernassa is a Swiss physician specializing in infectious diseases at the Cantonal Hospital St. Gallen and professor of health policy. He says, we have reliable figures from Italy and a work by epidemiologists which has been published in the renowned science journal Science, which examined the spread in China. This makes it clear that around 85% of all infections have occurred without anyone noticing the infection. 90% of the deceased patients are verifiably over 70 years old, 50% over 80 years. In Italy, 1 in 10 people diagnosed die, according to the findings of the Science publication. That is statistically 1 of every 1,000 people infected. Each individual case is tragic, but often, similar to the flu season, it affects people who are at the end of their lives. If we close the schools, we will prevent the children from quickly becoming immune. And there's many more, but I'll finish up with just a short comment from Dr. Sucharit Bhakti, who's a specialist in microbiology. He says, all these measures are leading to self-destruction and collective suicide based on nothing but a spook.